Hello and welcome back to our 2017 educational webinar series. I am Dr. Jill Brooks, Senior Director of Education for First Healthcare Compliance. At First Healthcare Compliance, we help you with a comprehensive compliance management solution tailored to your business, a hospital network, healthcare practice of any size, billing company, or skilled nursing facility. As part of our complimentary educational webinar series, we bring you experts from around the country to discuss relevant topics in the healthcare industry. Our theme for April focuses on revenue cycle management. We are so pleased to have Kevin Carpenter and Barb Zeleznik of Etactics presenting Optimizing Your Revenue Cycle Management, Tips on Getting the Most Benefit from Your EDI Partner. Etactics is a complete revenue cycle management solutions provider, serving health systems, hospitals, physician groups, individual practices, RCM, and billing companies. Kevin Carpenter is the product manager at Etactics. An accomplished and respected thought leader within the EDI Solutions division of Etactics, Kevin's mission is to help Etactics clients realize every dollar of revenue to which they are entitled. He accomplishes this by leading development, consulting, and implementation activities related to Etactics' state-of-the-art revenue cycle management software solutions known as Appeals Plus and Real-Time Eligibility and Claim Status Suite. Prior to joining Etactics in 2014, Kevin worked in a variety of environments, including professional services, retail, and nonprofits. Barb Zeleznik has over 25 years of experience supporting the billing departments in medical offices and hospitals. Her past roles have included working in the trenches of billing offices, implementation and design of practice management systems, and support. She joined Etactics in 2013 and is currently the lead client manager with Etactics. Her daily focus includes overseeing the EDI Clearinghouse daily production team and customer service staff. She understands the needs of what it takes to get a claim paid in a timely manner. A copy of their slide deck is available for download on your control panel. Feel free to submit questions into the question box on your control panel. We will address questions at the conclusion of the presentation. Your Paycom CEU certificate will be emailed to you from Paycom following the broadcast. There's no need to request it. Additional CEU opportunities will be available to BC Advantage members following the live broadcast. You'll need to check their website for details. Go ahead, Kevin. Barb.
Thanks, Jill. My name is Barb, and Kevin and I will be presenting today and describing all the steps that the revenue cycle relates to getting a patient encounter paid, beginning with checking the eligibility for that appointment, all the way through getting paid appropriately for your visit. We'll also uncover the differences between a regular medical billing clearinghouse versus building a relationship with an EDI partner or vendor. We will also explain why it is vital to take advantage of all the services available from your clearinghouse vendor, and following up with the comparing apples to apples for tangible services that you may need to consider in the intangible world of customer service. Every clearinghouse handles the transactions of sending electronic transactions, but how accessible, reliable is their support, and how does their support staff meet the needs of your office? And then lastly, we'll touch upon pricing options that you may want to consider or reconsider if you are looking to expand your services with your current vendor. We will be presenting some strategies to consider, especially when you're ready to make those changes.
So our first slide here is what is the revenue cycle. So we're going to explain to you a little bit what the revenue cycle looks like and how our organization plays a role in it. So I think in our slide presentation, you're going to see quite often the words EDI and clearinghouse used almost interchangeably with relation to the revenue cycle. So what do we mean when we say EDI? Well, the technical definition is electronic data interchange, and the clearinghouse is an organization that collects or distributes something, especially information. So you combine those two terms together and insert the medical purpose into it, and we're really moving medical information between doctors and insurance companies quickly and accurately. And also, just for our keeping everything straight for definitions here, we're going to start referring to you, providers, hospitals, billing companies, large practices, as the provider, just to keep things simple, and insurance companies or people that we're ultimately submitting that information to as payers. So how does an EDI partner facilitate the revenue cycle? Well, essentially, we're going to help you move throughout all the different stages of that revenue cycle you see on the right side there, that icon. We're going to move through that with other entities as well. So one entity is the payer, or as I mentioned before, the insurance company. That's who ultimately we are going to be sending all of these files and transactions to, or receiving the files and transactions from. Another key player in all of this, especially towards the end of the revenue cycle, you see the patient collections and patient remittance posting, are patient statement vendors. In some people's definitions, that might be part of the EDI or clearinghouse departments. In our company, we do have a statements department. They're separate from us. Our goal is to get you as much money as is entitled to you from the insurance company, from those payers. So obviously, the patient collection side plays a huge role, but that's not really what we're focused on today. The other entity that plays a huge part, obviously, in this whole revenue cycle is your practice management or hospital information system or hospital information management system, whatever you want to call the software that you're using today. So what are the roles of that system? Well, ultimately, they're generating the files that we are sending in to the payer, or they're the receiving entity that we send those files that we get back from the payer. Different PM systems and different HIM systems have different capabilities. So you'll hear us, especially at the end when we're talking about pricing, talk a lot about clearinghouses as a commodity versus clearinghouses as a value add. A lot of different practice management and hospital information systems already have everything you possibly need to do embedded within that software. So if you need workflow, maybe they have it. If they have ability to alter claims in a certain way and scrub them appropriately, that might be located in your practice management system. So really, if all you're looking to do is send those files in and receive those files from the payers, then the clearinghouse is really just a giant warehouse where we're sending information in and getting it back. However, a lot of clearinghouses like us, and ourselves included, have value add options as well. So in our different descriptions about the other services that we provide, we'll go in depth about which different pieces of those services might be part of a value add solution, or which ones would be standard in just a commodity type model. So going through the revenue cycle very briefly, the first circle on top is the patient eligibility verification. That's obviously where the patient is stopping in at the front desk, or maybe you know that they're coming in to the office or to the hospital, and you're sending a scheduled request out through eligibility. The arrow between the patient eligibility verification and claim submitted is where all of the coding and billing and creation of that claims happen. Your HIM system or PM system then batches those claims, and through a manual upload or automatic API call or some other automatic transaction, that is sent to us, the clearinghouse EDI partner. We then push that claim to the payer. That next arrow between claim submitted and payer remittance is where a lot of different pieces of information can happen. A lot of times that's a lot of waiting, and that's where some of our solutions come into play as well. But ultimately, you'll get something back in the form of a patient remittance. Hopefully it's electronic. You're getting an ERA back. That's where we provide that ERA back to you from the payer to your PM or HIM system, again, through either an automated process or a manual download and then upload into your system. You then post that remit into your PM system or HIM system. You might have to do some denial management depending on how the payer adjudicated that claim. And depending on their adjudication of it, if there is a deductible or copay or coinsurance amount that needs to be collected or some other kind of PR, that's where the statement vendor comes into play.
A medical clearinghouse. In the early days, they were nothing more than an electronic post office or warehouse, as Kevin mentioned. You pushed a button, the claims went into cyberspace, and sometimes they made their way through to the payer's adjudication system to get paid. And every payer required their own proprietary format for an EDI claim. And then HIPAA came around and standardized the electronic submission of transactions, which allowed more payers to participate in sending transactions electronically and expanding their services like eligibility, electronic remittance, and claim status. So without a clearinghouse or a practice vendor, a practice will need to call an insurance company to check the eligibility, print paper claims with no guarantee that they ever get to the payer, send claims electronically connecting to the payers individually, remembering password managements, to send the claims and to pick up the reports and or remittance. And in some practices, this may just be a weekly task, but that's actually disadvantaged. Those need to be checked on a more regular basis. The more sites that you have to visit manually, the more time you're wasting, and the opportunity for missing timely filing deadlines increases. So an EDI partner or vendor should provide all the services in that revenue cycle template that Kevin just described, because no office has enough staff to keep up with all the stages of the revenue cycle without an EDI partner. So if you do have a clearinghouse or an EDI partner or vendor, some of the things that they should be providing and what you should be doing to keep up with those services. They should be providing you with a payer list. And in the beginning, when you were first setting up your tables or setting up your system, you research the payers to find out what plans you would be able to work with. This should be something that you visit very frequently, since many vendors will be adding additional payers as they become available, and you should be researching to see if there are any regional plans that are available that are local to your area. A question you should also be asking is, who is determining the EDI routing of the claim? Are you totally in control of the route that claim is taking to the payer, and are you following up with the claims to make sure that they are being sent to the right EDI partner? How is a payer enrollment managed? Unfortunately, HIPAA doesn't standardize the enrollment process. That would be awesome. Unfortunately, every payer has their own format, whether that be a paper or an online portal, or possibly no paperwork, but a setup is required. Having a vendor that actually orchestrates that or manages that for you is a very big plus, especially as you are adding additional services, whether they be eligibility, claim status, or remittance. You need to offer services for all stages of the revenue cycle, and you need to be taking advantage of all of them. How are the files uploaded and downloaded? Kevin mentioned that manually was an option, and that was in the beginning, that was the option. You need to reach out to your vendor and see if they offer or have expanded their capabilities to allow for automatic file transfer capabilities, and take advantage of those as well. You need to be able to track the history of a claim, starting with the availability of when the claim was received, when it was accepted, when was it sent to the payer, was it payer accepted or rejected, and be able to view the image of that claim in a paper format so that it's easy and friendly for you to review. You should not be required to recognize and understand all of the ANSI loops and segments that your claim is being stored and transferred in the format. They should also be able to provide you with a timely filing report in the event that your PM system isn't able to provide one. This is your tool for fighting any disputes with the payer with regards to timely filing. Your clearinghouse should also be able to provide you with reports, at minimum paper reports, but most recently or more advanced, reports that are able to be uploaded directly into your practice management system. The file of those is referred to as a 277 report. So again, this is something you should be checking with your PM system to see if they have the capability to interpret or read a 277 report. Therefore, the claim status would be updated directly into your PM system without having to utilize and work the human readable or the manual paper reports. These formats should be available with both the clearinghouse level rejections and acceptance, as well as the payer statuses of acceptance and rejections. Your vendor should also be able to provide you with customized reporting trends that address areas of improvement that you should be able to address to reduce the rejections. For example, if you see high tendencies of rejections with regarding to subscriber not found, that might indicate that you need to be a little bit more reverent with regards to checking eligibility and sending the claim to the right payer. They also should be able to provide a denial management tool that interprets the information on your electronic remittance for claims that are not paid or are not paid according to the payer contracts. And then a menu of pricing options that work best for your organization and the services that you are requiring or look to expand. And last but not least, the customer support. To me, this is priceless, and I can't tell you how many times we receive calls with regards to customers that, I lost my train of thought. Customers that actually are glad that we understand their issues, that you understand the levels of escalation that are involved, and that we are the ones that can reach out to the payers for clarity on their payer rejections. These are EDI levels of rejections that are not available on an EOB in most cases.
All right, so we're going to talk about all these different services briefly that an EDI partner should offer to you. You'll notice that all of these are part of the revenue cycle that we just looked at a couple of slides ago. Missing from this list, of course, are the statement vendor services, which, again, are offered by our company in a different department. Maybe a vendor you deal with has in the same department, although most people in our business do have at least some partner that offers statement services. So we're going to walk through all of these different, you might divide them up into different products. Maybe your pricing has them all bundled in together, but either way, this kind of functionality should be offered by your EDI partner. In all of the slides that follow for all these different services, we have kind of a standard format. We're going to tell you what it is, how it works, and then we're going to tell you some anecdotes, some cool things, tips and tricks about that particular service. And this is where it gets kind of into the fun part. So eligibility, what is it? It is verifying that a patient has coverage for a service before they actually have that service performed or before they do that office visit. So how does it work? It can be sent directly from your PIM or for your PM or HIM system. If it's integrated with a clearinghouse service, a lot of those are integrated behind the scenes, so you would never know that you had some sort of clearinghouse vendor. Maybe your PM system automatically has that baked in. Maybe they don't. Another option is that you are going to log into a portal that supports your eligibility transactions. You might type in some patient information. Maybe you're uploading an entire file into an eligibility portal, and you'll receive all those responses back. Eligibility runs on a 270 file format, which is an ANSI file. It's returned in a 271 ANSI file, and that information should be displayed back to you in a very easy to read and understand way. Regarding the tips and tricks, eligibility can be somewhat of a fickle beast. The reason is because it's part of real time. So obviously with real time, you're sending in information directly to the payer and immediately expecting a response back. Payers can be up, payers can be down. There are some payers that are much worse than others. Other ones are very dependable. Medicare, for example, is very rarely ever down. Blue Cross, Blue Shield, North South Carolina, I get a notification from them about every weekend that they're having 12-hour emergency maintenance. So it really does depend on the payer. Another interesting thing about eligibility, and really about most transactions altogether, is that it's not really a straight jump from the clearinghouse to the ultimate payer. A lot of times there are quote-unquote gateway clearinghouses that are the only ones that can receive a certain type of request. So from your perspective, maybe you use a certain vendor for an eligibility transactions, but really it goes through 4 different vendors until it ends up at the payer. In some cases, you're able to get around that and go direct with the payer, and in other cases, you're not. So if a vendor ever tells you that they have the immediate direct connections with every single payer, it's just not true. MDON/Change uses Availity. We use Change. Everyone is kind of intermixed with this different gateway system, so there are different points at which things can break down. Now there's another option. Some vendors offer the ability to screen scrape a payer website. So rather than sending in that true 270 transaction directly to a payer, we're able to use your provider credentials, your username and password, and screen scrape that insurance company website, which can be really cool because you can do that for payers that don't actually offer traditional eligibility services. Of course, the downside is of that, if they ever change the look and feel of their website on a whim, then that breaks. So there are definitely situations in which eligibility will not yield you a good result, but the case for eligibility is really in the alternative. The alternative is you're calling the insurance company for every single patient that walks through the door, or you're going manually onto that payer's website, so you're maintaining that huge labyrinth of bookmark lists, so you have to determine where it is that you need to check, remember all your usernames and passwords, and then you have to manually enter in that patient information. Or the third alternative is you just don't check, and then you have tons of rejections and denials based on that. So, even if a payer is down at the time you submit a massive eligibility file, and let's say you have 95% of all the requests were answered, but 5% weren't, it's a heck of a lot easier to get that 95% from your eligibility vendor and receive that response immediately and have to do the phone call for the last 5%. It is quite a volatile animal, but it is definitely worth having an eligibility vendor regardless of who it is or how many hops they go through. Another challenge with eligibility are the payer IDs. The payer IDs for different payers are not necessarily the same as claim payer IDs. And again, this is the same throughout all the different vendors you're going to find. A classic example of this would be for United Healthcare. Claims are all sent to the same payer ID. And then internally at United Healthcare, they divide out those claims into the respective plans. However, for eligibility, it's a different payer ID for AARP than it might be for your United Healthcare community plan or your standard commercial United Healthcare. So having a vendor that understands those kind of strange minutia and the differences in payer IDs and all that kind of transaction detail is essential. And you'll hear more about that, especially when Barb talks about the value of the customer service piece.
So now we're going to talk about claims. The whole goal is to get clean claims to the payer for the first time. So what a clearinghouse offers is when that claim file gets uploaded, whether it be manually or via a portal through your PM system, the clearinghouse scrubs that claim through, at minimum, the required fields that are required to send the claim to a payer electronically. However, they may also have additional edits based on some of the payer requirements, and only the clearinghouse accepted claims go on to the payer. So claims that are rejected at that clearinghouse need to be addressed and corrected and either uploaded or corrected at the clearinghouse portal if that is available. When a claim is sent on to the payer by the clearinghouse, the payers provide, again, there's no standardization, multiple levels of payer acceptance or rejection. So the first level at the very front door of the payer, it could be listed as a payer acceptance. And then the next day, that same claim is then slapped with a payer rejection. And it's because there are different levels of checking or scrubbing at the payers. The front door just basically is an acknowledgement that it acknowledges that a claim was received. And then as they actually try to process that claim through their adjudication system, and then they discover that the subscriber ID is not found, that same claim is given a payer rejection. These claims, when they are rejected at the front door, are not available to you when you're checking the IVR systems, since they did not pass through the frontline edits at a payer. A tip or trick to this is that your PM system, to minimize these edits, they may be able to take advantage of some additional functionality that you could put in place based on custom edits to fill a void pending on your updates to the PM system. They may also offer online claim editing, but keep in mind if you are taking advantage of this, you are not fixing the claim in the PM system, which is ultimately where the main source of that data needs to be fixed. You also need to review their reports in a very timely fashion. For offices that may only connect to their vendor once a week, you will be missing that opportunity that second day when the claim was paid or rejected and a whole week has gone by, whereas if you connect on a daily basis, you would be catching those in a more timely fashion. You need to clean up your rejections in a timely fashion because your time clock is ticking for those timely filing. Only the payer-accepted claims are sent in for processing. And many times the payer rejections are not user-friendly. They are very generic. So you do need to contact your EDI partner to assist you with the interpretation. If they don't know the answer, they will reach out to the payer for you and refer back to you the interpretation of the payer, which sometimes may have nothing to do with the actual message themselves. You cannot contact the claim status on those because they were stopped at the front door of the EDI vendor and didn't make it into the adjudication system where the customer representatives are actually looking for those claims. So your EDI partner or vendor would need to be your advocate to reach out to their method of how they sent the claim to that payer.
All right, and now we get to claim status. So what is claim status? It's another real-time request that's sent to the payer to check on the status of your claim and its adjudication. How does it work? Again, it can be tied in directly through your PM or HIM system through an API in the Clearinghouse. Again, if you have it today, you might not even know that there's a Clearinghouse behind the scenes making those transactions. Another way that you can do that is, again, by logging into the vendor portal. Maybe you have a claim screen and you're clicking a button and it's then sending out a claim status request based on the information that's on that claim already. The transactions in this case are known as 276 and 277 ANSI transactions. As Barb mentioned before, these are a little bit different than your standard 277s that come back as a result of sending in a claim to a payer. And also different than those same kind of proprietary reports that might not come back at all in a 277 format. The difference between this, they called it a solicited and an unsolicited 277, depending on if you are asking for it or if the payer is sending it to you as a result of them having received your claim. So a tip and trick, again, just like Barb mentioned, you might try and do a claim status check on a claim. Make sure you're not trying to do that on a claim that got stopped at the Clearinghouse because of a purposeful scrub, right? If a claim got stopped by the Clearinghouse because it didn't pass a CCI edit or an LCD or an NCD edit, and you try and do a claim status request, you're going to contact the payer and they're not going to know what that claim is because it never made it to them. Another tip and trick with claim status, it is a little bit slower to be adopted by the payers than something like eligibility is. So another thing that they do, just like for eligibility, is screen scraping, which again will go onto that payer's website to gain information about that claim and maybe even more information than what a normal claim status transaction would give you. Again, that can be a little bit volatile depending on if that payer updates their website frequently. But if you do use claim status, it can be extremely helpful because you can get information about if that claim has denied or not far before you ever receive an 835, which is our next slide that we'll be talking about. So rather than waiting to receive a remittance file electronically or by paper and waiting, some payers can take 2, 3, even 4 weeks, you could have that even a couple days after you sent in the claim and know exactly why something was denied. At the very least, you can know why something was rejected, and you can check the status of that. So you might make it a practice within your organization a couple of days after a claim is sent, or even the next day, to run a claim status check and see if that claim has been adjudicated yet and what the status of it is. Especially if if you're trying to keep your days in AR very quick, you'll know exactly how much money you're going to be expecting each day, each month, et cetera, et cetera. Another potential problem, just like eligibility, these payers have slightly different payer IDs. The same trick that happens with eligibility in the United Healthcare example is the same for claim status. Even though you're sending a claim into United Healthcare commercial, You may have to then send that claim status to a different payer ID if it's a United Healthcare Community Plan, their Medicaid plan. Another potential pitfall, you will definitely get good information back if you send the claim status request, but in the information you get back, they might be using a 277 code, but in the case that they're giving you denial information, they could be using claim adjustment reason codes back on an 835. So this could make it a little bit more challenging to do reporting based on these claim status requests and what the ultimate level of adjudication or the result of that transaction was. But that shouldn't stop you from utilizing it as part of your workflow. And now we move on to the electronic remittances, also known as ERAs. So what is it? It's a payment or a non-payment that's coming back to you with regards to a claim that you have previously sent a payer. Now, it could be in response to a claim that you sent a long time ago. They could be taking back money from you for some reason, or it could be, a response to a claim that you just sent. How does it work? Well, if you send the claim into the payer, they're going to get that ERA back to you. There can only be, usually, one clearinghouse that receives your ERAs. This is a lot different than claims, where if you enroll for claims with different clearinghouses, maybe you have different entities all sending different pieces of your business, different claims into one payer, but they're all going to come back in the ERA format to just one clearinghouse. So it's really important to know that, because we just had this example a couple days ago where a company had hired a vendor to outsource a certain piece of their business to work certain kinds of claims, and that vendor had enrolled for ERAs with a different clearinghouse, and all of a sudden they weren't able to retrieve ERAs from our clearinghouse anymore. And the reason for that was because they switched the enrollment. So it's very important to know where your ERAs are coming from, and if you're working with an external vendor, making sure that they're not going to try and reroute those ERAs. There's also a lot of different definitions about ERAs and what's contained within them. So you could have a file come back. The file might be referred to as the ERA itself or an 835, but within that file there could be information about multiple checks. So checks can also be referred to as 835s or maybe even remits. Within those checks or remits there are payments or non-payments, or you might say denials. So again, lots of different definitions. Probably the best definition for a claim that has come back to you in some form on an ERA is an adjudicated claim. So that could be a zero payment, a partial payment, or a full payment. So it's really important, again, to have a vendor that understands the differences in the definitions and can talk to you about the differences between those. Information that comes back on a remit is somewhat different than what gets submitted on a claim. So this is where we get into some of the fun tips and tricks. If you send out specific CPTs or HCPCS codes or procedure codes to a payer, what they send you back on that, adjudicated claim may have different CPTs than what you sent in, which can be extremely confusing for a biller trying to look into why something was denied. So a cool thing is that they're required, though, within the ANSI to show not only what they have put on it, but what you originally sent in. And that goes for CPT codes and procedure codes, along with the number of units billed and modifiers as well. So you should always be able to tell what was sent in versus what they're now adjudicating back. A lot of times they're doing that for some reason to bundle in different kind of CPTs that they deem should be paid all as one or not paid all as one. Some information that comes back on a remit is not quite as good as the information you sent back, or as the information you sent on a claim. Another example of that, other than what I just mentioned, is provider information. On a claim, you're sending in billing provider, referring providers, rendering providers, all kinds of different provider information. On that remit back, they're going to send you pretty much two pieces of information. They're probably going to give you something like a payer piece of information, or a payee piece of information, which might be your group NPI. And they're also going to maybe attach another NPI at each individual adjudicated claim level. So if you want to do any kind of reporting based on rendering or attending physician NPIs, it's best to match that remit up to a claim and pull the information from that claim. Also, diagnosis codes do not come back on remittances, so if you want to do reporting based on denials in any sort of way, you have to tie that back to the claim. Another interesting piece of information is the payer information that comes back isn't always quite as helpful as you'd like it to be. A perfect example of this is payers that have Medicare or Medicaid managed plans or Advantage plans, and also a commercial aspect to them. In their ERAs, they're putting all of those payments together, so you might not be able to differentiate between a managed plan and a commercial plan without some sort of advanced logic. So one way that your vendor might be able to distinguish between those is by looking for certain patterns. An example of this would be for Aetna. They had their commercial and their Medicare plans all in one check, and the only way that, at least I found, you can tell them apart is with the patient policy number. If that patient policy number starts with an ME, that happens to be a claim that was adjudicated under the Medicare Advantage part of their plans. So different payers have different kind of quirks like that your vendor can work through with you. Again, that might be something that's already baked into your PM system, but probably not. That might be a value add proposition that the clearinghouse can add in. And finally, with regard to remittances at least, there's a really important aspect to it, which is denial management. So on your ERAs, on the adjudicated claims, there are things called claim adjustment reason codes, or CARC codes for short. They will tell you for each different service line or attached to the claim as a whole whether something was adjusted off or not. Some of these adjustments might be expected, or, I'll say quote unquote acceptable because you know they're coming and you don't like it, but there's nothing you can do to get that money back. And other ones might be something you need to look at. So it's important to look at denial management from both a workflow and a reporting aspect. From workflow, you need to work through the different denials that are already there so that you can resubmit those claims or appeal and try and get that money back immediately. And from a reporting aspect, so you can see what areas are having the most problems, whether that be from a payer aspect, from a department by department aspect, like is this a coding issue or front desk eligibility issue, or is this a patient issue, or even from a physician by physician basis. So your denial management system, should your vendor offer that, which most do, should be able to not only determine what you think a denial is, so it should be able to take certain codes and either have them show up in the workflow or not. They should also be able to route specific denials to whomever you wish to work them based on whatever your criteria is. Really, the key word around denial management is flexibility, so that you're able to provide your own definition on what a denial actually is. Many vendors, especially in the clearinghouse area, and this is what we hear a lot from prospective and current clients, the PM has quote unquote something for that. But it's never really clear what that something is, or if that something is enough of something to be truly effective as a denial management system. Next section here is reports. So obviously that ties into denial management, and it ties into almost everything else that we've been talking about as well. If the vendor has a service, it should be able to report on the success or the failures of that service. So it should be able to report on how well your claims are going in, what your rejection rates are. It should be able to tell you what your denial rates are. It should be able to tell you what your success rate for eligibility and for claim status is. Everything that you do, you should have benchmarks for your own performance as a provider organization, for your vendor, and for even other vendors. So again, if you have someone else working your claims, or if you're a billing company and you have physicians doing certain part of the denial management piece and you're doing other parts, you need to be able to report on where are the leakage points, where is there a slowdown, where are there bottlenecks, so that you can optimize every piece of your business as much as is possible. An example of this would be we provide a revenue vitals report. So this would be somewhat of like a more glossy report, right? Because a lot of times a report is able to be obtained by clicking within your system, right? So within the portal, within the vendor's launch site, you can pick certain report criteria and have that presented to you in an Excel format or an interactive format. But if your higher level CFO or CEO or physician that owns the practice wants a report, they probably don't have a login, and it might be cumbersome for a revenue cycle manager or a biller to go in and run those every time they require a report. So having some sort of subscription service is probably worthwhile from your vendor, so that there could simply be on a regular basis a fully formatted glossy PDF provided to whomever needs it without having a lot of strain and effort to figure out what it is that they're looking for and how to run that report.
So customer service is a great part in keeping all of this together. They're the ones that your lifeline in every component that we've talked about. You need to make sure that you're aware of all the possible methods of communication that are available to you. There's obviously the phone call for those urgent matters, and check to see if they offer email to initiate just an inquiry on a more clarification for a payer or clearinghouse rejection. Just remember not to include any PHI in that email. Find out what their requirements are for soliciting an email, unless it's a secure email portal. They may offer also a ticketing portal, which is a secure method for communicating any inquiries or requests. And then there is the up-and-coming online chats where you're able to actually just submit an inquiry utilizing an online chat. Just be sure to keep that window open for when that response comes back. One thing to keep in mind is that some sort of a reference number or a ticketing number should be assigned to any calls or inquiries that require additional follow-up, so that anyone in your office has the ability to check on the status or the inquiry without having to know the full details of who made the call or what the full details are. Always ask for a reference number if you're making a call or an inquiry about any type of follow-up. Also, find out what the expected time frame is for any plan updates. If it does require a payer investigation, many times those take longer because the payers are on their own time frames and their own timelines. And even for a clearinghouse or vendor, they may tell us as we're making an inquiry that it could be up to 5 business days for something as simple as more details on a payer rejection. Somehow that seems awfully odd, but that's their global time frame. So find out from your vendor when you are making the inquiry what the expectation is, so that you know when a follow-up to an inquiry should be expected. Also find out what required information is needed if you are placing an inquiry. For example, if you do have a missing ERA or 835, the money appeared in the bank, but you did not receive that ERA. What's their fundamental details that are required to make that investigation? So, for example, the check number, who the payer is, the date and amount of the transaction. Sometimes these are as simple as it's been temporarily suspended because the ERA file was not in balance, and sometimes it's actually an indicator or an interruption at the payer where they are delayed. But that vendor should be able to provide you an update to let you know what the status is, and many times these are resolved in a very timely fashion. Find out from your customer service rep if your vendor offers customized edits. This has been an upcoming trend where we've found that some offices are making inquiries possibly because their PM system is pending this update, which isn't expected for the next quarter of the year, but they would like a claim suspended for some simple things like modifier review. Maybe it's not a full-fledged rejection, but they would like the claim halted at the clearinghouse so that it can be reviewed by someone before releasing it to the payer. Your vendor should also be providing you with global alerts, either from a clearinghouse point of view or sometimes even a payer interruption, whether that may be delays in releasing their payers or remittances, or system downtimes or delays in processing claims. They should be publishing these and making them available for you with the updated status and possibly archiving them for you to be able to review them at a later date. Plan maintenance window should also be communicated to you so that you know if it's going to impact your custom workflow in your office. And then they also should be providing methods for you to communicate PHI. Remember, no sending of emails in a PHI, no sending PHI in an email unless it's a secure email. They may offer faxing or secure portals for uploading copies of EOBs that may be needed to follow up with that missing ERA if possible. And then additional services that they may offer. For example, do they check your files for entire duplicate files so that if somebody is manually uploading a file, they aren't reaching out and submitting a file that was previously prepared on April 4th of 2016 and sending it on to the payer, to the clearinghouse today, only to be marked as a whole duplicate file at the payer. Also, do they notify you of high thresholds of rejections? This is a service that we just do at our company where we monitor the payer rejections and will notify a practice if we see a trend or an all of a sudden increase. We will make a personal notification to them, reaching out to make them aware in the event that they are not noticing that all of a sudden they are maybe being suspended because their provider didn't complete credentialing and all of their Medicare claims are being rejected. These are services above and beyond the normal type things of just providing answering the phone and a simple explanation of a payer rejection or a clearinghouse rejection, but things above and beyond that should be hopefully something that entitles you or solicits you to create a relationship with your vendor.
All right, and our last slide before we go to questions are pricing considerations. So the main point of pricing considerations, just like within the denial management piece of everything, is flexibility. All that flexibility, though, really boils down to two main spheres. One is commodity-based pricing. So commodity-based pricing really is just, you're sending in the information and you want to get it back. There's not any value add. It's really just that warehouse model that we talked about earlier. If that's all you're looking for, and you have workflow, you have all the capabilities within your PM and HIM system, and you just want to be able to get information to and from the payer at a good price, then you should be able to get a lower price that makes sense, possibly bundled in with all those different services without having to worry about little nitty-gritty details like per click or anything like that. Now, the other option is the value add based pricing. And this is where some of those other extra things that you heard us talk about with the different services come into play. So if your PM system or your HIM system doesn't have a good workflow for dealing with denials, or doesn't have appropriate scrubbing capabilities for your different claims, or it doesn't have different pieces that you just need to be able to do, or maybe they just don't have a good support team, so they have the capability, but you'd rather reach out to the clearinghouse vendor to have something done, then you can go with a value add based pricing. So different pricing models, especially for that point B, might be a per transaction or quote unquote per click. So that would be, each claim cost X number of cents, or each remit costs X number of cents, or each eligibility transaction. That works well for some people. But could be potentially scary for some people that just want to try out the system and send off a lot of eligibility requests, or they don't want to be tied down to a specific number because maybe they want to be able to resubmit claims as often as needed and just not have to worry about it. So then your option might be a per provider. This is especially useful for large physician groups or single doc practices or smaller groups. It's really easy to tell what the appropriate pricing level should be if you break it down by the provider for all those different services or in a bundle. And the last option, and this especially is good for like different hospital systems, is by service. So just a straight access fee for each one of the different services. If you want to use the eligibility service we provide, it would be X dollars per month or X dollars per year. Again, so you don't have to worry about how many clicks are we doing for this. So your vendor should take into account all all the different price points and considerations that you have, including your previous pricing, so that you both end up with something that you're happy with and can move forward with, and you're getting at least some sort of a better deal than you had before, whether that be because of added capabilities or better customer service or just more functionality. All right. All right. And I believe we lost our contact slide on this one, so we're just going to move back to the beginning.
Okay. All right, we do have a few questions, and we may, in lieu of the time, we may need to answer some of these questions offline. But first off, could you give an example of a custom edit?
Okay, a custom edit could be requested by an individual practice that would only run against their claims that could be possibly linked to a payer. So, for example, for my Anthem Senior Advantage claims, with the place of service of hospital emergency room, or 23, if the CPT code equals 99XXX and it does not contain the modifier and the rendering provider was John Smith, hold that claim so that we could review it because it may need an attending or a locum tenens added to it. So Clearinghouse may be able to provide a custom edit that they may or may not charge you for that would hold that claim so that it can be reviewed by the practice and then possibly edited or released to the payer.
Okay. What causes the scenario eligibility checking states eligible, however, claim is denied for patient not eligible at time of service?
Oh, this is a great one. So there can be a couple different reasons that this might happen. One reason, which is really kind of the silliest reason, is that the policy number you send in for eligibility might be slightly differently formatted than the policy number you send in on a claim. So a classic example of this is on a claim you might have a policy number for the payer GEHA, which the policy number ends in GEHA, and you would send that in on a claim. But when you send it into eligibility, it can't have GEHA on it, or else they're going to reject your request entirely. So some payers are a little bit, it's really kind of bewildering why the policy number would be different for one transaction versus another, but that's one reason. Another reason is you may have checked the eligibility prior to their visit, and you may have billed a claim a couple days after their visit, and it is possible that a patient's coverage has lapsed in that amount of time. Or it's possible that, you know, even within that amount of time it hasn't lapsed, but at the time of adjudication the patient hadn't paid their premium, so then really the insurance company wasn't going to cover it after all, and then they're not going to pay it. So, you know, eligibility is something you want to check all the time. Is it 100% bulletproof? I would say no, but you're going to have that whether you're checking on their website or not.
Okay, next question. Do all clearinghouses send direct to all payers?
So another good question. This is what I was referring to in the eligibility section. Definitely not. Most clearinghouses use other vendors who are probably, you know, it's kind of a co-opetition type environment. So, you know, for example, we have many direct connections, but we do utilize other vendors to get certain transactions to certain payers. For some payers, that's simply the only way to go. You can't get to that insurance company without going through a specific vendor. In other cases, we utilize vendors because we send so many transactions that we're able to get a really good price, possibly even better than going directly to the insurance company. And that's why, at least for us, we're able to price things down to a pretty low price because we get those kind of great deals. So that's how we can compete on that kind of commodity-based pricing versus other vendors. Whereas if we connected directly with every single payer, we might not be able to do that as well.
Okay. And do all payers provide the same type of claim submission confirmation?
Definitely not. There is no ANSI requirement that states all the levels of confirmation. However, there is the first line of a 999 file confirmation, and then and that may be as far as you get with some payers, where they will confirm the file was accepted or received, and then you get no additional level of confirmation unless a claim is possibly rejected at the payer. Many of them are the Medicaid plans. Every state's Medicaid is on its own, doing nothing similar to any of the other states, and they have their own little drum as to what level or type of reporting that they will be providing. So a clearinghouse vendor would be somebody that would be able to interpret that and then possibly update the status of a claim file directly.
Okay. Well, in lieu of the time, I think we'll take the rest of the questions offline. And if you send us more questions, we will forward them on to Kevin and Barb. Your Paycom CU certificates will be emailed to you automatically. Please join us again next week for another educational webinar relating to revenue cycle management. It is April 11th at noon Eastern Standard Time with Pam Jocelyn of Practice Management Institute. You can register for this webinar and also request a demo of our compliance solution on our website at 1sthcc.com or give us a call at 888-543-4778. Everyone have a great day.